Good evening, everyone. Today, I wish to deliver a presentation on a topic which has been assigned to me, and the name of the topic is ICD. We'll begin with the full form of ICD. ICD stands for International Statistical Classification of Diseases and Related Health Problems. What is ICD? When we talk about what ICD is, we realize that it is a method of classifying diseases, injuries, and the causes of death. As to what purposes that ICD fulfills can be summarized into three particular aspects. The first aspect is that ICD helps in standardizing the methods of recording and tracking diagnosed diseases all over the world. The second aspect, which ICD focuses on, is about research of diseases, their causes, and the treatment that is associated with those diseases. And the third aspect, which the ICD focuses on, is about settlement of insurance claims and the accurate billing for a particular disease which a patient is undergoing or is suffering from. Next, we'll look into the history of ICD. So, when it comes to the history, Francois Boisier de Sauvage de la Croix is credited to be the first person in making an attempt at coding the diseases systematically. Followed by his efforts, there have been many more efforts in coming up with the best uh, way of systematically classifying diseases. But at the most recent attempts and what is considered to be the best way of classifying the diseases, ICD 9, ICD 10, and the most recently published ICD 11 are considered to be the best methods of classifying diseases. As to who publishes ICD, ICD is published by the World Health Organization, which is situated in Geneva, Switzerland. And as to who uses ICD, it is used by all of the member states of the WHO. Next, we'll discuss about the structure of ICD. So the ICD system is organized into various different chapters, and each chapter covers specific disease groups. There are various different versions of ICD, such as ICD 10, ICD 10 CM, and ICD 11. ICD 10, for example, has a version called ICD 10 CM, which is used in the United States for clinical modifications. Now, coming to how ICD works, ICD are codes which are in the form of an alphanumerical format. So, we can take an example of an ICD 10 code, which is I63.9, and it represents a cerebral infarction. In the same codes, a C50.9 would mean malignant neoplasm of the breast. So, when it comes to understanding how these diseases are coded, we can look at this particular example. So, the way the diseases are classified and understood is in this format. Suppose A01 is written, it would mean that a patient is suffering from a disease. Further, A01.0 would mean that it is a disease of the lungs. And likewise, it can further be broken down to understand whether the disease is a simple disease or if it's a complex disease, if it is affecting if the particular area in which the particular disease is being affected, and whether the patient is encountering that disease for the first time or if it has occurred before. So this is how. So this is basically how the disease is classified, or it is classified or coded against each patient. Moving forward, we'll look into the importance of ICD. So the importance of ICD can be associated for the four different areas that have been mentioned here: for healthcare management, for billing and reimbursement, for public health, and for research, and in their own ways. In healthcare management, it helps in managing patient data, tracking the diseases, and planning the treatments. In billing and reimbursement, it helps in the settlement of bills and also in accurately billing for a particular patient's disease and for the settlement of insurance claims. And when it comes to public health, it helps in tracking the disease outbreaks and analyzing the health trends. And when it comes to research, it helps in it helps the researchers in using the ICD data to study disease patterns and treatment outcomes. Now, given that ICD 11 is the most recent ICD publication out there, it is fitting that we look into it a little bit. So, first of all, it is the latest version of the ICD. It was published by the WHO in the year 2018, and it is an improvement over ICD 10 with expanded, with better library of diseases and better way of using an electronical health records with improved usability features. There are certain merits and demerits associated with the usage of ICD. And when it comes to merits, like I've already mentioned, it helps in the improved accuracy and specificity in coding. It helps in better alignment with modern medicines, and it helps in enhanced data analysis capabilities. ICD also has demerits. The first weakness is that there are frequent updates and revisions, which makes it difficult for people to keep track of. And the other difficulty is that it requires a lot of training and it requires expertise for the accurate coding of a particular disease. And when it comes to frequent updates and newer versions being released, it makes a very resource intensive aspect, and therefore it is not very cost effective when it comes to resource allocation and related aspects. But in conclusion, we can say that ICD is actually a standardized and global system for coding medical conditions and procedures. It is essential for healthcare management, and it is essential for billing, it is essential for research, and also for public health. And looking into the future, it is sure that ICD is always evolving and it will play an increased role in improving healthcare worldwide over the time to come. That was all from my end. Thank you so much.